A lot of people ask me when I'm doing Botox, is it safe? Because it's a neurotoxin and it's a nerve agent or something like that. So let's talk about it a little bit. I would say Botox has become like really popular for both medical and cosmetic purposes in multitude of ages right now, starting from 19 years old. But many people still wonder, is it safe? And what is it going to do to my face long term? So let's see. First off, let's talk about what Botox is. Botox is a brand name for a botulinum toxin, and you can get any other brand names in the United States, outside the country, but we want to make sure we're using FDA-approved products here. A substance derived from bacteria called Clostridium botulinum. When it is injected in small, controlled, purified amounts, Botox works by temporarily blocking the nerve signals in the muscle, and it relaxes them. This helps smooths the wrinkles and also smooths the muscles, and thus it is treated in conditions like chronic migraine, excessive sweating, jaw pain, trigger points, and things like that. So Botox is safe? I would say yes. If it is FDA approved and it is in United States, it is very, very safe to use, along when it is administered by a licensed, experienced professional who has taken proper courses and has done cases under the belt. Botox is generally considered pretty safe. It has been used in medical field for over 30 years, and now it's coming into dentistry as facial reconstruction and facial aesthetics. And again, Botox is 100% FDA approved, especially this brand and Zeman, for various processes in cosmetic treatment. However, like any medical treatment, are there risks involved? Yes. That's why we want to make sure that you're getting it done through a licensed professional, because we want to make sure that we are not making those muscles relaxed, which keep our skeletal system up and running. Because if we are putting Botox in a muscle that keeps our most of the joints up and you relax it, you will get an adverse effect, and that muscle is going to go to sleep. One of the most common concerns I also hear is spreading beyond the trigger point. Can that happen? Absolutely, that can happen. Again, if the clinician is not practiced enough, or they're not versed enough where are they putting in, yes, Botox can actually leak in different areas and cause the other muscle to go to sleep, evidently. But hey, don't worry, these side effects are very temporary, because Botox can be reversed with some medications. It takes a few months, or if with the medication, it can take like a month or two to get rid of our body. But with experienced professionals, you will never be able to go through any of this. They're very careful. Before undergoing Botox treatment, your provider will review your medical history, which they should always, including any allergies to any kind of vaccines, so we can counter the dose or triage the dose really well. It also is important to note that Botox isn't a permanent solution. It is a symptomatic solution. While the results can last between 4 to 6 months, the effect will gradually wear off as your muscles begin to regain activity, right? And it also depends on how fast your metabolism is. Is there a lot of alcohol consumption? The Botox becomes it gets consumed really, really fast. This means that you'll need to return for a follow-up treatment to maintain your results. Now let's talk about what happens if Botox is used incorrectly or administered improperly. One of the risks is the injection could be placed in a wrong muscle group, which was supposed to keep you upright, and leading to unintended results like drooping of the eyes, drooping of the corner of the lips. If it is injected too deeply, it could affect deeper muscles and cause it to be hard for people to swallow or speak or smile really wide, because the wrong muscle kind of went to sleep. Again, it's really important, very highly important, that whoever is administering it, you check where they got trained, do they have proper certifications, and how many of that were done in their certification. In rare cases, people may develop allergic reactions to Botox, which can cause symptoms like itching and rash and difficulty in breathing. which is also controllable, but if the medical history was taken really well, you should be in good hands. Overall, Botox is safe, effective for most people when administered by a trained licensed professional or a dentist. And if you are considering Botox, it is important to have an open discussion of what your expectations are and what the clinician can do for you in your expectations, because not every wrinkle and every line of your friends is just like yours. So the results will never be the same. It has to be studied. The wrinkles and the muscle movement has to be studied by that professional licensed provider for you. Remember, Botox can help reduce appearance of wrinkles, alleviate pain, in tension headaches, trigger points, improve your overall confidence. But like any other treatment, it is essential to be informed and make sure it's the right choice for you. Again, if you're interested in learning more about Botox, please schedule a consult so we can give you the proper information and the knowledge to keep you comfortable and confident. And if this is the right choice for you, we're right here to get you the treatment done.